Usually dose of asthma, pregnancy, pathophysiology. Oh, hi everybody. All right, today we're going to be talking about bowel obstruction and endometriosis. So, as we discussed, this is a rare complication of endometriosis, especially deep infiltrative endometriosis, in which you can have bowel obstructive symptoms where the bowel is infiltrated and it occludes and narrows the lumen, causing the problems in now passage of food and products down the lumen. So it can involve the rectum, it can involve the sigmoid, it can involve the area called the cecum and the appendix and the joining of the small bowel to the large bowel, and it can involve the small intestines. Obviously, the symptoms would be related to the area of the bowel involved, but you can have mainly bloating, difficulty in eating, difficulty in passing stool, abdominal pain as usual, worsening sometimes during the periods because it flares up, and loss of appetite, as well as sometimes not being able to now pass stool or bowel. And these are actually going to be a complication that, if not corrected, can be dangerous to these women. How do we diagnose it? We diagnose it based on symptomatology and history, as well as possibly a deep infiltrative endometriosis scan, transvaginal, where we could pick up the rectum lesions up to the sigmoid area, but it's not very effective in picking up lesions above that. So in the small intestines, the cecum, we may need to resort to things like the MRI. How do we treat this? Well, depending on the extent, you can start with the same painkillers and medications that could be hormonal, but final treatment may still have to be removal of this lesion that's occluding the lumen of the bowel. And there are different approaches to it. Either you try and shave it, or you'd make a small nodule excised out of it and repair the bowel, or you may have to actually cut a segment of the bowel and re-anastomose these bowel loops. So this is a very complex surgery and would require a multidisciplinary team and an endometriosis center to do this. Thank you. Bowel obstruction and endometriosis.